Hi, I'm Dr. Alexander Digenis, and I'm a board-certified plastic surgeon here in Louisville, Kentucky, where I've practiced over the last 15 years. I'm a Kentucky native, but I trained outside the state, being doubly boarded in general surgery at Vanderbilt, and then doing my aesthetic plastic surgery fellowship at the prestigious New York University Hospital and Manhattan Eye, Ear, Throat Hospital in New York City. I returned to Louisville in 1997, where I joined the faculty at the University of Louisville as a professor in plastic surgery. I accepted then a position with Dr. Norman Cole, after which I acquired and took over his practice in 2001. Since then, I've inherited a large patient population of patients who we continue to take care of regarding facial aesthetics, with a great emphasis on surgical facial surgery as well as non-surgical applications and therapies. In terms of facelifting, facelifting is a very individualized type of surgical therapy. Patients' faces change differently from individual to individual, and in my opinion, there's no cookie cuttering the approach to each person's face. So we spend at least 45 minutes to an hour on your first consult to evaluate your face as well as its different aspects of aging and changes, and we try to suggest an overall program including skin care as well as surgical and non-surgical approaches to help beautify the patient's face. In general, we usually start with the skin and then work up towards surgical procedures. A facelift generally addresses the changes in a person's face due to gravity. There are normally two aspects of facial aging, and those two are, one is expression and the other is gravity. As I say, gravity always wins. And in the face begins to fall, becoming more square rather than triangular. Now, different people age differently, so some people have greater laxity in their neck versus their jowls or versus their cheeks. And again, an individualized program, usually involving a lifting of subtype, counteracts these gravitational effects. So you'll hear a variety of different descriptions of facelifting, including mini facelift, short scar facelift. The media is replete with a number of new type of lifts that I think are just recycled marketing campaigns, because basically the anatomy has not changed. Many new techniques have entered into our armamentarium for each patient, but that each patient needs probably a very customized approach. So in general, we evaluate each patient, and for example, some patients only need a neck lift. Some patients need a full facelift. Some people only need the lower parts of their face addressed. But this usually involves a surgery, as most people understand, putting incisions in front or into the ear and then hanging behind the ear to be able to lift up the skin and the underlying tissues. The new advances in facelifts is that more and more has been able to be accomplished through smaller incisions, and thereby names such as the short scar facelift, trying to reduce unsightly scars such as the scar often seen in older facelifts on the back of the neck, as well as hiding the scars now inside the ear rather than in front of the ear. So there are a number of advances which also include technologies like sealants, which reduces bruising and bleeding postoperatively, as well as swelling. So patients very often look much better than they used to after facelifts within a week to 10 days. So we have a variety of different approaches depending on each person's particular aging characteristics, and we try to address that on their consults when they come in and speak with us.